Great. Welcome, everybody. Thank you for joining us today. My name is Laura Marks, and I'm the program manager at Women for Afghan Women's New York Community Center. Thank you so much for joining us to learn about a topic that impacts so many of us, either directly or indirectly. I want to take a moment to encourage you to be mindful of your response to this discussion. If at any point this conversation feels heavy or triggering, please step away and take care of yourself. Approximately 1 in 3 women and 1 in 4 men experience severe intimate partner physical violence from their intimate partner in their lifetime. About 1 in 5 women and 1 in 13 men have experienced sexual violence by an intimate partner. During Sexual Assault Awareness Month, Women for Afghan Women hosts an informal discussion with our partners to better understand what sexual assault violence is and how it impacts us and our friends and families. We hope these tools can help you learn more about responses, resources, and support survivors in your life. I'm delighted to be joined today by Alpana Patel, Program Coordinator and Clinician for the Mount Sinai Sexual Assault and Violence Intervention Program based at Elmhurst Hospital. Kazal Zakaria, Mental Health Counselor at Women for Afghan Women's Virginia Community Center, and Shireen Roy, Co-Director of Programs at Connect here in New York. Welcome, Alpana, Shireen, and Kazal. Please share what type of work each of your organization does to support victims and survivors of sexual assault. Maybe we can start with Alpana. And you're on. Your audio is not working.
Is it working now?
It is.
Now it's working. Okay, all right. It was hello, everybody, and thank you so much for taking the time to join this really important conversation, especially in the month of April, which is Sexual Assault Awareness Month. And thank you for the introduction, Laura. So I work for the Mount Sinai SAAM program, and we are a crisis intervention program and a nonprofit organization within the Mount Sinai health system. And we provide direct services to survivors of sexual assault, domestic violence, and sex trafficking, which includes free and confidential therapy, counseling, advocacy, information, and referrals. We also provide emergency room advocacy services as well. I believe our number is about 9 hospitals now across 3 boroughs, Queens, Manhattan, and Brooklyn in New York City. Just again, want to thank you for everybody coming.
Thank you. Shireen, would you introduce yourself and tell us what you do?
Yeah, thank you, Laura. I apologize, I'm a little under the weather today, but I'm so happy to be here, and always it's a privilege to work with Women for Afghan Women and my colleagues here today. As the co-program director at Connect, a lot of our work is under the umbrella of intimate partner violence. We're looking at sexual abuse, in that gender-based context throughout New York City. We work in all 5 boroughs, and mainly our real work with survivors are via our groups. We have groups for survivors, we have monthly roundtables, and community-based programming. And again, thank you for having me.
Thank you, Shireen. And Sal, would you talk about your work as well, please?
Yes. Hello, everyone. My name is Kazal Zakaria. I'm the mental health counselor at Women for Afghan Women, Virginia Community Center. With my job, primarily, I provide counseling to clients. And so whether it be survivors of sexual assault or any other mental health issues, I provide counseling. One of our jobs is to also empower women and to be able to provide services, social services. We have a caseworker. We also provide legal services and educational services, employment as well. But mostly, with our center is being able to help the Afghan refugees, evacuees, resettling, but also with acculturation, adjusting. And there's a lot of trauma with this population. So being able to encourage them to seek help and being able to give them that safe space to be able to talk and encourage them to be able to talk and open up so they gain some relief. And that's the start, right? Being able to, again, and encourage and empower them. So that's mostly our goal. And to be able to help, again, the community in any way that we can and that we're equipped to do. And thank you for inviting us to this panel. Very excited to be here. This is a very important topic, I think, for everyone to be aware of and to just have knowledge of. And so I'm really glad to be here today. Thank you.
Thank you, Ghazal. We're delighted to have everybody here. So this is our agenda. Alpana will speak first about sexual violence and sexual assault. Shireen will speak about sexual assault in the context of partner violence. And Ghazal will talk about the impact of sexual assault on mental health. So I'm going to turn it over to Alpana. She is a licensed clinical social worker who provides services for survivors of sexual assault, child abuse, human trafficking, and intimate partner violence. She has an MSW from Columbia University and a master's in sustainable development from Brandeis. She's also completed postdoctoral graduate training in integrative trauma studies at the National Institute of Psychotherapy. She has substantial experience working on the issues of gender-based violence in the United States and abroad. She's been working in the anti-violence field for more than 20 years and is fluent in the South Asian languages of Hindi, Urdu, and Gujarati. So Alpana, I'm going to turn it over to you.
Thank you. So sexual assault is a broad umbrella phrase that encompasses various acts of violence where a sexual act is used as a weapon to hurt another person. It's the act of forcing someone to engage in unwanted sexual activity, which includes rape, sexual abuse, exploitation, harassment, incest, stalking, pornography, molestation. And I would like to also just differentiate as you talk about sexual assault and versus anything versus how we use like sex crimes or they engage in when we're talking about sexual assault. So sex is something that is inherently a consensual activity, where sexual assault is non-consensual. So just in differentiation in terms of how we talk about the subject matter. Engaging in a sexual act with somebody when they're physical and not able to give consent due to their age, if they're under the influence of alcohol or other substances, is also considered sexual assault. I think we lost the PowerPoint. Oh, there it is. Yeah, thank you. So that's just a brief definition. Under that umbrella, when we talk on the spectrum of it, there is, rape, which is when there's penetration, including oral, anal, and vaginal by a body part or an object without consent, and sexual harassment is something that happens that's more of verbal which is verbal in nature, where somebody is harassing you, and the context of the harassment is sexual in content, as well as which can be verbal, nonverbal, and it could include threats and blackmail. And another aspect of this that I just wanted to also mention is cyber abuse, which is becoming increasingly common as sexually harassing another person. I know one of the common phrases that's used is revenge porn, but I believe the cyber abuse justice is more encompassing of sexual harassment and stalking that happens in the area of in the world of Wide Web, the internet. And again, sexual violence and sexual assault umbrella terms, which include the various things that that I mentioned. And one of the things that this diagram has, forced marriage, where somebody's not giving consent to marry another person, and within that, sexual assault can also take place. And also within that context of marriage, sexual assault can also happen in marriages as well. And in the United States, it is illegal in all 50 states now. Rape in marriage is considered a crime. So what should we know now that we have identified what sexual assault is? First and foremost, and the most important thing, if you all don't remember anything else, what we talked about, our names, organization, or anything like that, is to remember that it is never a survivor's fault. Sexual assault happens for one and only one reason. It's because one person makes a choice to hurt another person in a sexual way. So it is never a survivor's fault. And sexual assault is illegal and is a crime. And survivors have a right to get medical care, have forensic evidence collected, receive counseling, legal help, any other supportive services without having to report the crime to law enforcement. So when we talk about going to the hospital, it doesn't automatically entail getting police involved. There's often a misconception that if I walk in the hospital, the hospital staff is going to call law enforcement right away. And that's absolutely not the case, unless there was a weapon that was used, or if there's a knife wound that resulted in the assault, due to the assault, sorry. Law enforcement is not going to get involved. So every survivor has a right to go to the hospital and get confidential help, get medical care, without having law enforcement involved. So I just wanted to clarify that. And reporting to law enforcement can also happen if that is something a survivor chooses to do at any other point. Statutes of limitations vary, by state and the nature of the crime. However, the most important thing is that a survivor can walk in the hospital, get help, and then think about what they want to do when it comes to reporting a crime. And it's never too late to get help for any medical issues that somebody may be experiencing due to the assault. Certain medical care and evidence collection, however, is time sensitive. It has to happen within a certain time frame. If you're not sure, just walk into an emergency room or call a crisis line. They will direct you to the right help. And we're going to provide the phone numbers in the presentation as well. And as I mentioned a little while ago, reporting crimes vary by statutes of limitations and depends on the state, and can be explained later on by somebody working a crisis program or within law enforcement. But most important thing at that moment, if you feel like you need to get help, it's okay to walk into hospital and get help or call a crisis line if you've been assaulted. And again, remember, it's not your fault, and you're not alone. Within the United States, there is a network of state coalitions that will, you call state hotlines, call national hotlines, and you will be directed to a crisis line in your community because of how the network is. So free and confidential help is available. And these are some resources. There's the National Sexual Assault Hotline number, 1-800-656-4673. You call that number and they'll route you to a local crisis program in your area. There is also resources for survivors on Futures Without Violence. It has a lot of great information, including great prevention resources. In case of any emergency, please call 911 or walk into your nearest emergency room to get the help that you need. And these are some local resources for New York City. There's New York City Domestic Violence Hotline, operated by Safe Horizon, 1-800-621-HOPE. This is a number if you live in New York City. You may have seen on many different brochures and flyers. There's also Sexual Assault Hotline, 212-227-3000. And the NYC Police Department number is for it's the Special Victims Hotline, which is for information for reporting any crime or to report a crime. If you call this number 212-267-7273, the phone will be answered by a detective. They will get information from you and direct you to the appropriate Special Victims Bureau that will also then follow up with you to report the crime. It's a very, very they're all extremely helpful. I've called myself when I have questions. Then somebody will always answer the phone. It never goes to voicemail. It hasn't happened in my experience yet. And again, call 911 in an emergency or walk into an emergency room. And these are some resources in Virginia. There is the Virginia Family Violence and Sexual Assault Hotline, as well as the Fairfax County Domestic and Sexual Violence 24-hour hotline, 703-360-7273. Really, really important numbers to keep in mind. And if you're not sure, you call a hotline number, even if you're not sure it's in your neighborhood or your community. The worker that answers the phone will direct you to the right place.
Thank you, Alp, and I'm really grateful for all of these wonderful resources to help folks who are in crisis and need to find the resources either near them or near their friends and family. So I'd like to move on to our next section with our colleague, Shireen Roy. Shireen is one of the lead trainers for the Understanding Domestic Violence Essentials and Intersections program. She runs support groups for victims and survivors in English and Spanish, facilitates a monthly women's roundtable, trains doulas and healthcare professionals to screen for partner spousal abuse, and provides technical assistance to connect community partners throughout New York City. A Latina born and raised in the heart of South Bronx, Shireen's professional experience is an anti-violence advocate and educator, specializing in intimate partner violence and its root causes. Since 1996, she's worked in direct service, grassroots organizing, community training, and women's and girls empowerment. She received a dual master's degree in counseling and education at Columbia University's Teacher College. So to build on what Alpana told us about sexual assault, Shireen, would you talk to us about intimate partner violence and why it's so difficult to leave an abusive relationship?
Sure. Thank you, Laura. After all of this really fruitful and important information that Alpana shared with us, we want to thread it through the umbrella of intimate partner violence. And first and foremost, I think this is something that people tend to not think about. They tend to think about sexual assault or sexual abuse in the context of a stranger. But we know, and as Alpana mentioned, that it happens in intimate partner relationships or ex-intimate partner relationships. Our take on it, or what's important to walk away with, is that it's for us to understand that it's something that actually happened, or the threat of it. And if you put it in the context of tactics that an abuser is using to cause harm, you can find, or we can highlight several different categories: physical, sexual, psychological. Under that, we could add verbal, emotional, spiritual, and economic abuse. And really what it does, it changes the life experience of the survivor. The person is now making choices and decisions to survive, rather than having their normal, regular everyday life. And this kind of power and control, as we call it, it's a pattern. And the goal of the abusive partner is to really do two things: establish power and control, and to maintain it. And it's really by any means necessary. And it creates an experience, a 24/7 experience of fear, which I think is something very different than what we're told. We kind of are told that these experiences are event driven or just go by events. But in this context, we know that it's an everyday life experience. Next slide.
So why is it so difficult to leave an abusive relationship?
So with all of the factors that we kind of have gone through and discussed in partnership with survivors, if you're able to work with them, have conversation with them, number one obstacle is fear, as I just mentioned, fear of multiple things, whether it's fear for their life, fear for their children's lives, fear of, will I be able to start over again? Will my family be impacted? A fear of multiple things. And it kind of is this type of fear that may be very confusing because this is someone who you have a relationship with or had a relationship, someone you may have children with in a home. So there might be some mixed feelings of hope and fear, but fear is definitely there. When we think about children, children may be a reason to leave, but it also may be a reason to stay. Many survivors feel like, maybe perhaps it's safer to be in our home with two parents. Perhaps our children will have a more stable life if they're not uprooted, have to change schools, have new friends, live in a new community. So certainly those are things that can create an obstacle to leaving. And, I think we all know how difficult it is to survive in the world financially, especially now post-COVID, everything has gone up. So there may be, reasons, financial reasons, I cannot afford to just get up and leave. I don't have a job. I haven't had a full-time job in 20 years. I'm in debt because of my abusive partner. So all of those kind of real things that make complete sense to us can play a role in why it's difficult to leave. Housing, same reason. If, for example, your credit is really poor because your abusive partner has destroyed your credit, you may not be able to rent an apartment or pass a credit check to, have a mortgage or to purchase something. Housing is a big issue. And again, if you have children and you're not just caring for yourself, you're thinking about what I can do to keep a roof over their head. There may be family pressure. Family may really insist on, this is a good person. They are financially supporting you. They may be financially supporting the extended family. They, really have done good things for our family back home. We don't really think separation is a good idea, and on and on and on. And this is another layer. And immigration issues. I may be here and my partner or husband is a US citizen and I am not. I may be fearful that I will be deported, and many abusive partners use deportation as a really big threat. So many survivors will say, I would really rather not make any waves and stay in my home, and I can raise my children or just be safe overall. There may be beliefs, faith beliefs, religious beliefs where divorce is frowned upon, or you may have a relationship with your religious community, and that religious community is basically saying, you have to stay, you cannot leave your partner. It's important that you don't get a divorce, and that may also be a big influence. And lastly, and I'm sure there are many, many others, health. Your health may be a factor. What if you have a chronic illness? What if you are in a wheelchair? What if you're concerned that I can't get a job because I have a chronic illness, or, I have all these multiple health factors and it's difficult for me to be on my own. So, these are just highlights and really the tip of the iceberg. There could be multiple combinations, multiple configurations, but what we should take away with it, with understanding that even if I'm experiencing these things, it is just really difficult to just get up and go. Next slide. Okay, so as we basically, mentioned with the definition of intimate partner violence, what can occur and what it would look like really varies. But these are some examples of what it can look like under the umbrella of intimate partner abuse. Someone who I am married to, or who is my partner, who I may live with, who I may have a child with. And, with these various examples, you can see that it's pretty overwhelming just by the bullet points. You're looking at being pressured or coerced in to sex, a lot of possible aggression and reproductive coercion, meaning being forced, to become pregnant when you do not want to, forced and coerced sex with animals and objects. When I talk to survivors, these examples are very, very difficult for them to convey. A certain level of shame that's added to the layer when it comes to sexual abuse is present. And hearing themselves say this out loud can create a lot of anxiety and a lot of emotional pain and suffering. And I know we'll get into that in the next segment, but I want you to be mindful of that as we go through this list. These are not easy things to discuss. Forced to engage in pornography, prostitution, or stripping, sex trafficking. And yes, that can occur with a partner or former partner. It's not just a stranger scenario or situation. You may find that in a relationship, the abusive partner is the one controlling all aspects of their sexual relationship and their intimacy. When they're intimate, how, where, all of that falls under that umbrella. I work very closely with doulas and midwives and those in the birthing world. And from what they have shared and from what I have seen, there could even be sexual abuse during pregnancy, labor, and delivery. And there can be a control of medical care as well. And I will put a star next to that because during pregnancy, abuse does escalate. And that's something that we know statistically that occurs. Threatening to put explicit videos or photos on the internet, just like Alpana mentioned earlier. This whole thing about putting things online and the revenge porn, all of that is a blackmail tool that abusers can use. And, many times survivors have said, I did not even know that I was being recorded. We were, home, and I didn't know that there was a camera on the other side of the room. And then lo and behold, that is used as a tactic by the abuser to have power and control over the survivor. As we discussed, rape can occur in relationships and in marriage, sexual assault, the guilt tripping. If you do not engage in this sex act with me, I will do X, Y, and Z. I'll harm you, I'll harm our children. I will make sure everybody sees these photos. Birth control, sabotage, and pregnancy pressure is real. And, it concerns me now as we're thinking about what's happening in our country and the issue with the Dobbs case and all the states making all these changes in regulation, and how many survivors are raped and are pregnant and don't know what to do. Forced abortions can occur as well. Many survivors have another added level of shame, in the sense that I did not want to have an abortion, even though this pregnancy may have not been planned, and now I've had 3 and I'm feeling really, really bad. And again, as we mentioned, this is not your fault. This is not the fault of the survivor. But many times these feelings creep in, feelings like maybe I should have done this or I could have done that. Forced to have sex with others, which also heightens risks of STDs, just like infidelity. And what we're seeing really now more than ever is forced plastic surgery, so that the body parts, mostly, breasts and buttocks and vaginoplasty, all of that is, changed and modified, not because this is something that the survivor wants, but because it's something that the abusive partner is having them do via force. Okay.
Thank you, Shireen, for talking about these difficult issues that really do affect so many people and are so pervasive. And the impact of having these issues in your life, these challenges, some real impact on mental health. So we're going to welcome my colleague Ghazal to talk about how sexual assault impacts mental health. Ghazal has a master's degree in counseling psychology and a master's degree in mental health counseling. She's worked in the field for 10 plus years. She previously worked for private practice counseling individuals, couples, and families. As part of USAID, she provided mental health services to Afghan evacuees at Dulles Expo after the evacuation in August of 2021. She was also a USCRI behavioral health manager working with Afghan refugees at Quantico Marine Base. So Ghazal, I welcome you to our talk and look forward to hearing what ways that we can talk about how mental health is impacted.
Thank you, Laura. The mental health is definitely an important area in this topic, because many survivors of sexual assault may develop mental health conditions after this traumatic experience. Having a mental health concern or issue does not make the person weak or broken. And I think that's really important to understand. People tend to cope with trauma in different ways. However, mental health professionals can help survivors by offering them a safe, private, and most importantly, non-judgmental environment, so that the survivor is able to talk about their traumatic experience. Individuals need to understand that they don't have to go through their pain and suffering alone. They can get help, and there is help out there, but they just have to understand that they need to take that step to get the help. That's very important for the, whether it's encouraging them, empowering them to be able to seek help. Some of the most common psychological effects or impact of sexual assault that sexual assault victims may experience is feeling of shame or guilt. Unfortunately, they may blame themselves for what happened to them due to the trauma and the negative emotions related to the sexual assault. And that's why, they tend to bring that pain onto themselves and, taking that responsibility, even away from the abuser. So because of that shame and guilt that they feel, they may experience, sleeping, problems with sleeping, not being able to sleep. And, sometimes it could even be just sleeping all the time, wanting to sleep all the time. There may be disorders, eating disorders, definitely anxiety disorder is one that's seen, that's prevalent, experiencing the fear that the attack could happen again. There could be panic attacks, agoraphobia, afraid to leave their home, or develop chronic fear of the type of person who harmed them, whether it's similar features or, same height, whatever it may be, certain things that may trigger them. And for them to go back and kind of to the traumatic experience and feel, the pain and suffering and going through that again. There could be avoidance of certain places, things related to the traumatic event. It could be social isolation where, just they don't want to interact with anyone, or just withdrawal from, that interaction, and withdrawal in the sense of, keeping to themselves, staying away from friends, family, because that's hard for them to get out of that, the emotions and the painful feelings that they're experiencing. PTSD, where they may experience intense memories of the abuse. And PTSD can create a state of hypersensitivity in the brain, which may increase the fixation on traumatic events, keeping them fresh in the memory, almost like, it just happened yesterday, and it's always right there to haunt them. Flashbacks, they can have flashbacks, which are dissociative events of the momentary lapses in perception of reality, taking them back to the traumatic experience, making the individual feel as if they're kind of reliving that moment. And it's challenging for them to get themselves out of it. And that's why it's really important for them to, again, seek that help, to get the therapy, to be able to kind of work through all the pain and suffering and the emotions and the feelings, and to be able to get back into a state of mind where they're able to not have these flashbacks, be able to interact, be able to get out of the house, back to some kind of normalcy in their life. They may experience depression and suicidal thoughts even, or actions, because of the loss of body autonomy, which is challenging for them to cope with. That they didn't have control over their own bodies. Someone took that control away from them. And the being able to work through that is difficult. And so that's why they need that help from other sources, whether it's mental health counselor. Again, they need to seek that help because it's difficult for them to get through it alone. Especially, again, going back to the shame and the guilt that they feel inside could be overwhelming for them. It could also reduce their sense of self-worth, not feeling that they're worthy, and that affects relationships. So denying themselves of what they have a right to, whether it's being, having relationships, interaction, having fun. So those are, some of the things that they may avoid, keep themselves from enjoying life to some extent. Depressive feelings may be mild and brief, or they can be intense and ongoing. It really depends on the person. But, especially if they're intense and ongoing, it's something that, they need help with, for someone to be able to work through that with them and to, come to some resolution. Because otherwise it could definitely control these emotions and feelings. Negative emotions and feelings can control their life. So the most important thing to encourage for survivors of sexual assault is to make them aware that they are not alone, and they should not have to go through the pain and suffering by themselves, and that there is help out there.
Thank you. It is so important for people to know that there are counselors like you and like everybody on our panel, and others out there who are ready and able to help deal with the trauma.
Absolutely, yes, and then that's important. I know that as hard as it may be for them to talk about the experience, it's just that it's really important because there's so much that they have to go through. And that is really difficult for them to be able to just do it by themselves. And so they need to be encouraged and empowered to seek help.
Thank you. So how can we all support survivors of sexual assault? Here are some tools that we can use to help our friends and loved ones who need support. Because sometimes we're talking about ourselves and sometimes we're talking about our loved ones. We want to share some things to help everyone keep in mind. So as we've all said, believe the survivor, right? First and foremost, believe the survivor. And listen. It's not a time to pontificate or share your own thoughts. It's a time to listen and step back. Practice empathy, compassion, be non-judgmental. Ask how you can support them. What do they need? It need not be ice. It might be food shopping or something, very concrete. Trust is an earned experience, not a given. You can't assume someone will trust you just because they're your relative or your friend, your sister, right? People have to really know that they can count on you to provide the support they need, which is not necessarily advice. It can be advice if that's what they need, but it might just be an ear. I love this one. Shireen actually put together these slides. Be an anchor, not a rescuer. Something I have trouble with, I always want to jump in and fix something. That's not what you need. A lot of times you just need to be there and provide that support that someone needs to have in their life. And be familiar with the resources that are available to survivors. So we're going to share those slides again. The national resources, the National Sexual Assault Hotline, Futures Without Violence. They have wonderful resources at Futures Without Violence for prevention and for ways to handle how you're feeling. Of course, always in an emergency, 911, or go to an emergency room. New York resources, the New York Domestic Violence Hotline, 1-800-621-HOPE, and the New York City Rape and Sexual Assault Hotline through Safe Horizon at 212-227-3000. And as Alpha told us about, the Special Victims Unit at the NYPD is actually a resource and not just a way to report. So they're at 212-267-7273. And for our team in Virginia, the Virginia Family Violence and Sexual Assault Hotline is 1-800-838-8238. And the Fairfax County Domestic and Sexual Violence 24-hour hotline is 703-360-7273. And of course, if you want to contact any of us, here's our contact information. You want to take a screenshot. These are our organizations and how you can contact our panelists. And I just want to thank everyone for spending their afternoon with us, spending this hour with us to talk about such an important topic. We're grateful that you are here. I'm so grateful for our wonderful panelists for sharing their afternoon with us, sharing their wisdom and resources. Thank you. Thank you very much.
We're open for questions, right?
Questions? We have Sabina is on the chat. No questions. Someone's raising a hand. We can't see the participants. I don't think. Oh, yeah, if you're raising your hand to speak, please put your questions in the chat. How can one support someone who does not want to report? With that.
So I think one of the most important ways to support who doesn't want to report is respecting that choice and decision, and not making them feel like they're making a wrong choice or decision by not wanting to report. So if they make a choice not to report based on whatever their reasons are, that it's okay. It's okay. It's always their choice to not report. So that's one of the first things, in supporting somebody that doesn't want to report a crime. And another important thing is to help them plan for safety. What are some ways in which they can stay safe? If one way of safety planning is giving them the option of filing a police report, and if that's something they're not ready or willing to do, how can they be safe, right? Does the person know where they live or where they work, or and just starting from those things and helping them safety plan, for to be safe, and giving them their options, at the end of the day. So I think that's really important. And then listening to what their needs are, what they feel like they may need. I think it was Shireen mentioned, maybe it's going grocery shopping, or going out to grab a bite tea, or whatever it may be in that moment that a survivor needs, that you're able to do as a friend or in your professional capacity, is to take their cue and take their lead. And one thing I will add, though, sometimes it is also okay if you are worried about somebody's safety. It's also okay to let them know that you are worried about their safety. Sometimes because of a survivor's defenses, there could be minimization of increased threats that they may be facing, perhaps further danger, for further risk of re-victimization. And if you are concerned about that, it's okay to let them know that you're worried about their safety. Not saying specifically what necessarily may be, but just expressing it to them so that they can perhaps, take a step back and okay, maybe there's something I should do so that I don't get hurt again, perhaps. So those are just some quick tips that came to my mind.
Anyone else want to jump in?
I would just
As far as
agree.
oh, sorry.
Okay. I would just agree and just second, all of that. And as Alpana mentioned, we are respecting survivors' agency. And even as we reflect back to them things that are good information and knowledge, that's how we are anchoring, and survivors really also need to feel believed in. And when you believe them, you also have to convey that you believe in them, and that you'll know that you're going to be that anchor, and that they are going to make the best choices and decisions for themselves, given that we provide them as much information as possible. There's a lot of misinformation there. There's a lot of things that the community says that are myths. So it's good just to give them what and always work in partnership with them. We are not telling them what to do. We are just sort of being there to navigate some of these difficult systems. Thank you.
I think what Mopana and Shireen said is very important. And the other piece is to be there and to listen to them, and to really listen with without any judgment and be able to validate what they're saying. Sometimes maybe that's all they need because of the trauma that they've experienced. They want to be able to just, not necessarily have to hold everything in, but for someone to be able to listen to their pain, listen to their suffering, and what they're experiencing. And sometimes, because they don't want any other help, they don't want, to report it or anything. They're just maybe at a stage that they're just completely closed off to any outside, help. But just being able, if you're the one person that can be there for them, then being able to give them that safe space to listen to them, and to not judge them, and to be genuinely connected with them when they are talking to you, because that could go a long way for them. Just someone there that's able to listen to them and not judge them and believe in them, just like Alpana and Shireen said. I think that's critical.
Thank you all. There's a statement of question. Thank you for this panel, really good information. I was a SART advocate in New York for 4 years, and my worst experience was with SVU. Their questions sometimes were rude and would re-victimize the survivor. Have any changes been made? Alpana, you seem to be nodding.
So I'm so sorry that that's what your experience was, and it's still not a perfect system. However, there has been a lot of training that detectives and including ADAs have been going through within in New York City and all the boroughs to be more trauma informed and to use trauma informed interviewing ways to interact with survivors. So one concrete way in which how that is being implemented is when a survivor comes to the emergency room, they choose to file a police report. SVU detective, if they are able to come, they will come to the emergency room and they will just make an initial contact, get very basic preliminary information, primarily to just assess if there was any, if any like weapons or any further risk of danger. If this is somebody who's like a serial, anything happening where somebody's a serial suspected serial perpetrator, just to assess for that, because their obviously main responsibility is public safety. So just do a quick check for that. And they won't take a formal statement in the emergency room. It used to be like that, but not anymore. They will get preliminary information, contact information, give an appointment to a survivor, give a time and date to come to the special victims unit if it works for them, and take a formal statement when it works for them. So that has really taken off a lot of pressure for survivors to remember things accurately, to give a formal statement, because as in for them, it's, if not one of the most traumatic experiences that they have gone through. And that moment to give specific details and things like that that are important, undoubtedly, for for the process, the criminal justice process, but not the most conducive in an emergency room setting. So that has helped a lot. They're definitely much more trauma informed. They have been much better about validating a survivor's experience, even though it may not move forward in the criminal justice context, but saying, we believe you, we believe that you were violated. However, because of how the laws are, or because of limitations of evidence, this case is not able to move forward. So all of that has made a difference. Of course, it's work in progress, but there's some concrete ways in which things have changed for the better over the past few years.
I would just say for survivors of intimate partner violence where there is rape, it's still been a little bit challenging, where because they are maybe married or living under the same roof, they do experience a different kind of questioning sometimes. but I am glad to hear that they are making some changes in the hospital.
Thank you. We received a question about what language resources have been helpful in talking about sexual assault. You want to take that? What kind of, I'm not sure if it's about translation or if it's just about language usage.
Oh, well, if it's about both translation and language usage, I do feel Futures Without Violence has a wealth of information, both as handouts and pamphlets or just overall on, you know, best practice language, but also in a variety of other languages. So whichever way that question goes. And then in New York City too, I think, you know, at Connect, we try to do that as well. And I'm sure, you know, many other organizations do as well.
Thank you, Shireen. There's a question about a copy of the slides. So this video will be published on YouTube and will be available there. But I'm also happy to share slides if you'd like that. And I'm going to post, let me share my screen again so you can see everyone's contact information. So here are all the folks who on our panel from Women for Afghan Women, Connect, and Mount Sinai Sexual Assault Prevention and Intervention. So this will be obviously available through the video and it's on the slides as well. I don't see any more questions. If anybody has any questions, please feel free to put them in the Q&A section of the webinar, and we'd be happy to answer them. And I don't see any. So once again, I'd like to thank everyone for spending time with us today. And stop share. And thank our panelists for their wonderful presentations and sharing this really important information, especially for Shireen, who is not feeling so well. We're really grateful for you to pushing through today.
Thank you for having me. And thank you to my wonderful panelists. I just love working with you today.
Fabulous team. So thanks, everybody. Lovely to see you. Have a good day.
Thank you. Bye.
Thanks. Bye.